So I want to make sure that I speak to you today as a member of Governor Ivey's cabinet and her authorized representative for all hazards coordination. I want to talk to you as a agency lead, and I also want to talk to you as a father. Okay, so the first thing is Governor Ivey has allowed her cabinet, and we are trying to model the behavior that we're asking for businesses, society, other functions of government, to reduce the human-to-human contact, to reduce the transmission of the coronavirus, which results in the COVID-19 disease. And so as we're doing that, we're implementing some of the same measures that Dr. Harris is and the other cabinet members and our counties and cities are doing. But today was the last day that I gathered the entire agency together to let them know, respect this disease. Respect this disease. We're taking and implementing measures to preserve our workforce and capacity because Alabama is counting on us. So we're going to be teleworking. We're going to be splitting and shifting our shifts to minimize the 6 foot human-to-human contact, and we're going to try to do everything virtually and remotely. And as we batten down to protect our workforce, our most precious resource, our people, there may be a problem with a social recession. So we need to also think about those people who are the most vulnerable in our society as we eliminate that human-to-human contact. It doesn't mean don't have contact with them. It doesn't mean don't care for them, because this is a human disease that is going to require a human response, which is going to require a whole of government response, which will require a whole of society response, a mobilization of all Alabamians, all U.S. citizens, to reduce and slow the transmission of COVID-19 so it stays at or below or around the max capacity of our healthcare system. That is the fight that we're in right now. So that was my discussion as a cabinet member, and my appreciation for the things that Governor Ivey has done to unleash the authorities of her staff during this national emergency and Alabama public health emergency. And I want to remind everyone, this is not just a public health emergency. This is a national emergency of national security significance. All right? We don't even have to declare a major disaster declaration. All we have to do is a federal state agreement. We're already there. And it's so challenging because of the nature of this disease. So now I'm going to talk to you as a father and a 27-year TAC pilot. The nature of this disease is what is causing our younger population to say, I don't fear the COVID-19. And I'm glad we don't fear it, because fear has no place here, all right? But what I'm asking you to do is respect this disease. Please respect this disease. Because even though our younger, healthy population can be asymptomatic or have minor symptoms, they're still transmitting the disease. Okay, that should be concerning. Right? So we could be going about our daily activities and not reducing our human-to-human contact and kind of engineering our societal behaviors and norms to reduce the contact. This is an aerosol disease transmitted through coughs, sneezes, and mucus on hands, and the virus is being transmitted. So the way we do things, I mean, as simple as, did you push the elevator button with your fingertip or your knuckle? Did you open the door with your hands and did everyone else? Or did you do it with your elbow or your back? Those are minor things, but everything matters, okay? Everything matters. So what I just described to you is that the most efficient vector of this disease is the young and healthy population. They may not know they have it. And then the most vulnerable is our elderly and those who have underlying conditions that we should be concerned about. We should be concerned about. We need to protect our elderly, all right? So we're in this together, and we are going to do our best to share information fast because it's a fast evolving event. And the other thing I want everyone to understand, that this is a disaster. Okay, that's why we have a national emergency, and it's going to be multifaceted. For instance, you may be wondering why the hurricane and weather guy is standing in front of you today talking about cyber during a healthcare crisis. Well, the HHS just received a cyber attack today as they're trying to mobilize and plan a whole of government response. So as we collectively as Alabamians and the nation are trying to minimize our human-to-human contact, and we're incentivizing teleworking, telecommuting, putting things on the web, we're reducing our vulnerability to one virus and increasing our vulnerability to another virus in the cyber realm. All right? So I'm asking everyone to take this seriously, and it's going to take everyone's action. And Governor Ivey has given us those authorities to mobilize Alabama and to talk to you to make sure that you're empowered to do those things that we need you to do to slow the transmission of the disease. This is no time for fear. It's time for respect and believing you have a purpose in helping those around you. That's the nature of a whole of government and whole of society response. That's all I have, but I appreciate the time that Dr. Harris has given to me. I appreciate the ability that Governor Ivey has given to all her cabinet members and the functions of government to work collaboratively, to really think through the nature of the problem and all those consequences and unintended consequences of actions that we need to work through to keep Alabama strong, to keep Alabama healthy, and to really keep our eyes on the future and where we want to go.